Amid the surge in COVID-19 cases in Singapore, Thailand, and Hong Kong in May 2025, a message attributed to the Singapore Ministry of Health is being shared widely on social media platforms. The post claims that Singapore has discovered that COVID-19 is caused by a bacterium rather than a virus after conducting an autopsy on a deceased patient, allegedly in violation of the protocols of the World Health Organization or WHO. The post also claims that Singapore authorities changed WHO recommended treatment guidelines and began using aspirin and paracetamol to treat COVID-19 patients. However, the websites of Singapore's Ministry of Health and Communicable Diseases Agency state that COVID-19 is caused by a virus called SARS-CoV-2. In June 2021, the Singapore Ministry of Health issued a clarification stating that the viral claim was misattributed and entirely false. The ministry confirmed that it did not conduct such an autopsy and that there was no change in treatment protocols based on any such discovery. They also clarified that the post spreads misinformation about the pathophysiology of the disease, which is not supported by scientific evidence. In addition, the Singapore government published a detailed fact-check article that reiterates that COVID-19 is a viral and not bacterial infection and that aspirin has no direct effect on the virus. They also made it clear that their treatment guidelines remained consistent and had not been altered due to any findings related to autopsies. The WHO has also debunked the myth that COVID-19 is caused by bacteria. According to the WHO, while there is no single definitive cure for COVID-19, some antiviral treatments can help reduce the severity of the disease, especially when used early and in high-risk patients. Research is still ongoing to develop better treatments and improve outcomes. Antibiotics do not treat viral infections, though they may be prescribed for secondary bacterial infections in COVID-19 patients. Moreover, contrary to the viral claim, the WHO never banned autopsies on COVID-19 victims. In fact, in September 2020, it released detailed safety guidelines for performing such procedures. The Indian government's PIB fact check has also clarified that aspirin and paracetamol do not cure COVID-19. In the past, we debunked the same claim when it was falsely attributed to Italy's health ministry. To sum up, as Singapore did not discover that COVID-19 is caused by bacteria after performing an unauthorized autopsy on a victim of the disease, this post is fake. Join our YouTube membership program and be a part of the journey of making public data meaningful. And remember, before you hit that forward button, pause.